Good day, I am Aldrin Havaliano and this is CHN scale isolation technique or infection control at home. By definition, isolation refers to the precautions that are taken in the hospital or community to prevent the spread of infectious agents from an infected or colonized patient to susceptible persons. So, there are two purposes of this procedure. First, isolation practices are designed to minimize the transmission of infection in the hospital or community by the use of current understanding of the way infections transmit. Then, second, isolations should be done in a user friendly, well accepted, inexpensive way that interferes as little as possible with client care, it minimizes discomfort of the client, and avoids unnecessary use. So there are also principles. So the following principles are essential when performing isolation technique to achieve the best results or the desired outcomes. So number one, isolation practices can include the placement in a private room or with a select roommate. Also, the use of protective barriers such as masks, gloves, and gowns, a special emphasis on hand washing, and a special handling of contaminated articles. So, because of the differences among infectious diseases, more than one of these precautionary measures may be necessary to prevent the spread of some diseases, but may also not be necessary for the others. Now, number two, the type of precautions used should be viewed as a flexible scale that may range from the least to the most demanding methods of precautions. So, these methods should always take into account that differences exist in the way that diseases are spread. So, recognition and understanding of these differences will avoid the use of insufficient or unnecessary interventions. So, for the guidelines or special considerations, number one, hand hygiene before and after all patient contact. Number two, the use of personal protective equipment, which may include gloves, impermeable gowns, plastic aprons, masks, face shields, and eye protection. Number three, the safe use and disposal of sharps. Then, number four, the proper room placement for the patients or the clients. There are also standard precautions. Now, standard precautions define all of the steps that should be taken to prevent the spread of infection from person to person when there is an anticipated contact with blood, body fluids, secretions such as phlegm, excretions such as urine and feces, but not including sweat, whether or not they contain visible blood, and also non intact skin, such as open wounds, and mucous membranes, such as in the mouth cavity. So, now special precautions include the use of one or a combination of the following practices. So, the level of use always depend on the anticipated contact with the client. So, these standard precautions include hand washing, which is the most important infection control method. Then the use of latex or other protective gloves. Then masks, eye protection and or face shields, gowns, proper handling of soiled client care equipment, proper environmental cleaning, then minimal handling of soiled linen, also proper disposal of needles, and lastly, the placement in a private room for clients who cannot maintain appropriate cleanliness or contain body fluids. So, for the equipment, a nurse must be equipped with personal protective equipment, which includes gown, a mask, goggles or face shield, and gloves. So, you start the procedure by greeting the client or the responsible family member and introduce yourself to establish trust and rapport. For example, good morning, ma'am. I am Aldrin Havaliano and I am a student nurse from MSU IIT. The next, state and explain the purpose of your visit to allay anxiety and promote cooperation. Then, after this, proceed to washing your hands to prevent the spread of microorganisms. Now, assuming I'm already done washing my hands, next step is to don your gown. So, just wear it like this. Make sure that the opening is always at the back. Then securely tie the gown at your neck and waist to make sure that it doesn't slip down during the patient care. Now remember to always use a new gown every time you enter the client's room and discard it as you leave the room. Never wear a contaminated gown into the other areas of the household. This is to prevent the spread and or the transmission of infectious agents. After donning your gown, the next thing you're gonna do is to wear your mask. So use a mask for all the clients with diseases that are spread via respiratory droplets. So to put on a mask, first place it over your nose, mouth, and chin, and then fit the flexible nose piece on the bridge of your nose before tying the mask in the back. Now, secure the ties at the middle of your head and neck. Then always remember to use a mask every time you enter the client's room and discard it as you leave the room. This is to prevent the spread of microorganisms or to avoid the transfer of infectious agents. Now after you're done with the mask, the last thing you're gonna don are your gloves. So this should cover the cuff of the gown at your wrist and should be free of obvious rips, tears, or holes to prevent areas of unprotected skin. So to put on your gloves, first select the correct size and type and insert a hand into each glove. So, sir, I apologize for this because my gloves, or the gloves that I'm using right now, are my spare gloves during my senior high school. So I have outgrown them and they are kind of goot. Then make sure to insert or to extend the gloves over the cuffs of your gown. After you're done with one hand, just repeat the procedure to your other hand. Now, remember to put on your gloves last and use a new pair when switching from dirty to clean procedures or between clients. This is to again prevent the spread of microorganisms. Now remember, if your PPE becomes dirty, you must change it. This is to prevent the cross-contamination from one client to another. Now, when you're removing your PPE, always remember that the front part or the outside of all of the equipment is considered dirty and the inside or the back part is clean. So, when you remove your PPE, always make sure that it is inside out. Like this. And then, for the mask, you'll have to roll it. Be careful not to touch the front side and just roll it and fold in half. Also, in removing your gown, you must remember this also. So, you do fold it inwards. So this is done to prevent the spread of microorganisms or the transfer of infectious agents. Now, once you're done with all of that, what you're going to do next is record all of the pertinent data, the observations, and the care rendered, because these data gathered can be used as reference for the future visits. Then, lastly, you make an appointment for a return home visit or a clinic visit for the continuity of care.